For many years, coronary artery disease has been one of the most common diseases in the world. Fortunately, advances in medical science and technology offer new hope. This short guide is intended to explain coronary artery disease and some of the methods physicians now use to diagnose and treat it. If you have questions after watching this, please don't hesitate to discuss them with your physician or medical team. To understand coronary artery disease, we first need to look at the heart. It is essentially a hollow muscle that pumps blood throughout the body. Coronary arteries are the vessels that supply blood directly to the heart. These arteries can become narrowed or blocked by a gradual build-up of fatty deposits called plaques on the artery wall. This is known as atherosclerosis, or hardening of the arteries, and is the underlying cause of coronary artery disease. When the arteries become too narrow, blood flow is reduced and the heart doesn't get enough oxygen. This is called cardiac ischemia. Angina, or angina pectoris, is the pain felt when this occurs. This puts people at risk of a heart attack, which occurs when heart muscle is actually damaged by the lack of oxygen. Up to 1/3 of people with coronary artery disease won't feel any symptoms. Others may have any of the following: chest pain, pain in the arm, jaw or back, tiredness or shortness of breath, nausea or heartburn, excessive sweating, palpitations or uneven heartbeats. You may have had some of these symptoms yourself, in which case you have probably already had several tests, such as an electrocardiogram or ECG to monitor heart rhythm at rest, an ECG during an exercise test, or a chest X-ray and blood tests to diagnose heart disease. Your physician will also take a coronary angiogram. This is an X-ray of the blood vessels of the heart. From this, they can see exactly how and where the coronary arteries are affected and decide on the best treatment path for you. A coronary angiogram means you'll have to undergo an artery catheterization. This is done under local anesthetic in a cardiac catheter laboratory, which is specially equipped with an X-ray machine and monitors. In this procedure, a very small, flexible tube called a catheter is inserted along an artery in your leg or arm into the heart. A dye is then injected through the catheter to highlight the coronary arteries. You will be connected to a heart monitor. Once you are ready for the test, you will be draped with sterile sheets. After being swabbed with antiseptic, the area where the catheter is introduced is numbed with a local anesthetic. The physician will then guide the catheter to your heart. You won't feel this, but can watch it on the monitor. Once the catheter is in place, your heart may skip a beat or beat faster. This is normal and no cause for alarm. Contrast dye is injected through the catheter to see how well your heart is working. You'll feel a hot flush when the dye is injected. This reaction is normal and will pass quickly. It is also important that you remain awake, so that you can move or breathe deeply if the physician asks, as this makes the X-rays clearer. The physician will then take X-rays from several different angles. Depending on the results, the physician will decide to treat you immediately or perform another procedure at a later date. The next step is called a balloon angioplasty, or PTCA. A medical balloon is used to open up the obstructed artery. The balloon is inflated inside the artery to push open the blocked area. The first part of the angioplasty procedure is similar to artery catheterization. Then, while watching the X-ray monitor, the physician runs a guide wire through the catheter to the diseased artery. A balloon is inserted over the guide wire and positioned at the site of the blockage. The balloon is inflated, pushing the plaques against the artery wall. The balloon may be inflated several times before it is removed. X-rays are then taken so that the physician can check the improvement. After the balloon is removed, the fatty deposits stay pressed against the artery wall, so blood flow is restored to the heart. Statistically, re-narrowing of the artery at the same site occurs in up to half of all cases. This is called restenosis and is seen within 3 to 6 months after balloon angioplasty. In order to lower the risk of restenosis, your physician has recommended a procedure called coronary stent implantation. This involves a small expandable wire mesh tube called a stent being inserted into the diseased section of the artery. After a balloon has made the diseased area wider, a stent is implanted to hold the artery open. This improves blood flow to the heart. A stent mounted on a balloon catheter is inserted into the artery and placed at the site of the blockage. The balloon is then inflated. The stent expands and becomes firmly pressed against the artery wall. One or more stents may be needed, depending on the length of the narrowing. X-rays are then taken, and the balloon may be re-inflated several times to ensure the stent is correctly expanded. Finally, the balloon is deflated and removed along with the guide wire and the guiding catheter. The stent will remain in place permanently, holding the artery open. With conventional stenting, re-narrowing of the arteries can occur in as many as 1 in 3 stent implants. Implanting stents can trigger swelling and excessive growth of the tissue that makes up the artery wall. This growth is the major cause of re-narrowing of the arteries, which can lead to further chest pain and may require further interventions, such as a replacement stent or cardiac surgery. For this reason, your physician may decide to implant the cypher stent, a drug-eluting stent to prevent re-narrowing of the arteries. This is called an anti-proliferative intervention, or API. A special coating on the stent releases a novel drug called sirolimus over a period of several weeks to prevent the swelling and excessive growth of scar tissue on the artery. And at the same time, a natural lining grows over the cypher stent, so there is less risk of complications such as blood clots. All clinical studies to date have shown that the cypher stent minimizes restenosis. In a recent clinical study, there was 91% less restenosis inside the stent versus a conventional stent, so there was less need for further procedures. In patients followed up for 2 years, diseased arteries implanted with the cypher sirolimus eluting stent showed no signs of re-narrowing after the 2 years. After your procedure, nurses will regularly check your vital signs. If catheters were inserted in your groin, you will be instructed to lie flat for a couple of hours. Once in your room, you may eat and drink normally. The amount of time you stay in hospital depends on how well the insertion site is healing. Most patients are able to go home the day after the procedure. After you go home, you should follow your physician's advice carefully. Take any prescribed medication as directed, and see your cardiologist or family physician on a regular basis. To stay healthy, you should follow a low-fat diet. It is also very important that you avoid smoking and exercise regularly. All these lifestyle changes can help reduce the risk of heart disease. This advice can help you ensure a better quality of life for years to come.